This is Winnie Anderson. I'm here with Dr. Patricia Rapici. Trish is a doctor of physical therapy in private practice in Woodbine, New Jersey. Woodbine is south on the Garden State Parkway, exit 17 to be exact, and it's just north of Cape May. Trish and I have been talking about all things related to aging and fitness and staying fit after 50 and fighting aging as long as you can. So Trish, let's talk a little bit about specifically about physical therapy and exactly what kinds of problems do physical therapists treat?
Physical therapists treat the problems that are involved with all the systems of the body. That's the cardio system, the respiratory system, integumentary system, which is the skin. But what people are most familiar with and what is most common for a PT to treat are problems that involve the musculoskeletal system and the neuromuscular system. In the musculoskeletal system, it would involve the category of muscle and tendon. Tendon attaches muscle to bone. So some of the common things that you would see there would be even headache, you would get neck and back strain, shoulder strain, tendinitis of the rotator cuff is a really common injury that physical therapists treat. Ankle strain, hamstring strain, various different muscle strains are frequently seen by a physical therapist. The other category would be joint and ligament. Ligament attaches bone to bone. So some of the things that you would see there would be whiplash. Whiplash is actually a sprained neck. You can also sprain the shoulder or dislocate the shoulder. There are commonly ACL sprains that people are aware of. That's the knee. Ankle sprain, very common. I don't know many people that haven't sprained their ankle. There are also disorders of the joints such as rheumatoid arthritis, osteoarthritis, a very big area of treatment for physical therapists. We also see spinal conditions, which include herniated disc, where the disc presses on the nerve that exits the spinal cord, spinal stenosis, which is a narrowing of the canal that the nerve runs through, also osteoporosis, where the bones become less dense.
Okay, so let's get back to, actually let's talk first about when somebody needs a physical therapist, and most people think about it in terms of injury, right?
Mm-hmm.
So, but there are other times, and you have it after surgery. How does that work? There's some changes that have occurred, right, in when physical therapy is called for.
Right. Traditionally, you would see a patient after surgery, any kind of surgery for repair, for trauma, breaks, all that. That was, pretty much the protocol. You would have PT afterwards because it would help you get better faster. But what has been discovered lately is that, actual studies show that your outcome, say with total hip replacement, is much better if you have preoperative physical therapy. And many physicians and large hospitals actually require that you, just like getting your blood work before your surgery, you have to go for preoperative physical therapy. And it's a really good idea because you usually have a condition, when you have a joint replacement, it's not something that you do quickly. You kind of really hang in there until you can't take it anymore, and most people anyway, and then they get their joint replaced. Well, all that time you haven't been active, your muscles atrophy, they get weaker, your joint gets stiffer, all the connective tissue in the area is, not in the condition that it needs to be. And you go in for the surgery and you get your hip replaced, but none of that connective tissue has any improvement. And so you're really working from behind the eight ball to recover because you have so much more to do. If you get some of that work done ahead of time, a little bit more flexibility, a little bit more strength, it's much easier rehab afterward, and you have a better outcome.
Okay, so fitness in general is not just a way to fight aging, it's also a way to just bounce back in general from a health problem, including
Right.
surgery.
I mean, how many times have you heard someone say, oh, the doctor said because I was in such good shape, I recovered quicker?
Right, yeah. Well, and that was specifically what they told me when I had some surgery. So let's talk about another issue that people tend to have as they age is this issue with chronic pain. You mentioned yourself, you put up with something for quite a while and then, all right, I can't take it anymore. How does physical therapy really help someone with chronic pain?
Well, pain is a very mysterious entity, and one of the mysterious things about it is that sometimes you can have a condition that causes pain, and the condition is repaired, and the pain remains. Mm-hmm. And so those folks, have what's called the chronic pain syndrome. There's also fibromyalgia, which is a very typical chronic pain problem. Diabetes can cause mm-hmm. chronic pain, and these are all things that a physical therapist can help you recover from and manage.
Okay, so before you take the pill, talk to a physical therapist about that. So let's talk a little bit about, back to some of the conditions that physical therapists treat. You mentioned specifically neuromuscular problems. Can you
Correct.
talk about some of those neuro issues?
Sure. Some of the conditions that you would see in that category would be traumatic brain injury, mm-hmm. spinal cord injury, multiple sclerosis, stroke, cerebral palsy. And those folks, generally have balance issues. Mm-hmm. They have motor loss. So a lot of the PT is directed toward improving those areas, and especially fall prevention.
Yeah, I was going to comment on that myself because as I have a traumatic brain injury, as you know, and it's quite often that we end up re-injuring ourselves because of this balance issue. So right. Physical therapy really made a tremendous difference for me, and I can only guess that these other folks in the neuro spectrum would only benefit as well.
Right, and there's also another condition that affects your balance. That's the vestibular system. Okay. The balance organs mm-hmm. in your inner ear, and often people that with head trauma also have a vestibular dysfunction, and those symptoms include dizziness and loss of balance, vertigo, which is the violent spinning sensation, mm-hmm. And also visual problems. So physical therapists can also do vestibular rehab. It's very effective. It's actually an area which I was specially trained.
Okay, awesome. So especially for these conditions that are chronic, I mean really, once you have MS, you have MS.
Correct.
So how do you manage it? How do you maintain some kind of vibrancy of life? Physical therapy then can play a really important role then in this. So let's talk a little bit about, so you have some issue, you think physical therapy might be a help for you. How do you make that decision that it's the physical therapist that you need to see rather than, oh, I pulled my shoulder, I got to go right to the orthopedic surgeon?
Well, you need to remember that you always have the choice to see a physical therapist as your first line of defense. There is a perception still in the country that you need a prescription or permission mm-hmm. to see a physical therapist, because at one time that was true, but the laws have changed. And so for many of these conditions, you can see a physical therapist and, begin your treatment. If the physical therapist is not comfortable with what they find and they feel that you need additional medical evaluation, then they will refer you to, the appropriate individual.
Okay. So if, I guess if your healthcare philosophy is to go with least invasive to most invasive, the orthopedic surgeon is the most invasive. So starting with a physical therapist then is really a way to get a clear diagnosis, get some direction. You don't need to see your GP, your general practitioner, to direct your care. A physical therapist can make that kind of assessment and then say, I can take care of you, you need to see somebody else,
exactly.
That kind of stuff. Okay,
yes.
Great. All great information. Thanks very much. So this has been Winnie Anderson with Dr. Patricia Rapici, of Woodbine, New Jersey, physical therapist in private practice here, and we've been talking about fighting aging and how we can deal with injuries that we experience. So if you'd like to get more information, Trish has a longer video for you and some additional information that you can have. You want to visit her website at restoremobilitynow.com. Thanks very much.